So you have type 2 diabetes, and now you're wondering what's going to happen to me. What are the complications of diabetes if I don't take care of myself with a healthy lifestyle? Well, one of the problems is your blood sugar level is too high. And when blood sugar levels rise above about 170, glucose gets converted to sorbitol. Glucose by itself is not toxic, but sorbitol is. And it causes all kinds of changes in enzymes and proteins in the body called glycation that result in a whole bunch of different kinds of things going wrong. We know that the fasting blood sugar will be high, and we also know that something called the hemoglobin A1C will be high. The hemoglobin A1C is a value that tells us what the blood sugar levels have been over the last 90 days, because what happens is that sugar gets bound to the proteins on hemoglobin, which every 90 to 120 days is remade in red blood cells. So the hemoglobin A1C should be less than a value of 6.0, and if it is, it means that your blood sugar control is good and you're doing what you can to prevent the damage that occurs in many different areas of the body, particularly the heart causing heart attacks, the brain causing strokes, the kidneys causing renovascular disease, peripheral vascular disease where you wind up with claudication, where you have cramps when you walk too fast because the circulation is too poor there, or damage to the eye called diabetic retinopathy, or damage to the nerves called neuropathy. Many other things in the skin and other tissues as well, including the liver. So what we have is a disease that's systemic, and there's much that we can do about it by making sure that those blood sugar levels are kept as low as they can, and that we don't challenge the body by having to make too much insulin because our insulin doesn't work well. So lifestyle becomes the big thing that will cause prevention for this disease and keep us from having the disease itself. There are a few simple things, a few nutrients that are breakthroughs in the last several years that you should know about and discuss with your healthcare practitioner. Things like L-arginine, which is an amino acid that causes dilation of blood vessels that are constricted, particularly in diabetes where we know we have sympathetic overdrive that leads to constriction of arteries in very important places like nerves and in many other tissues. We also know that things like chromium and vanadium and lipoic acid, GLA, which is evening primrose oil, fish oil, and vitamin C are important in supporting better control of our blood sugar levels and lower levels of the A1C and less damage to our body. So the complications of diabetes are something you can do a lot about. Lifestyle is the cornerstone for prevention and for treatment once it's there. Supplements and herbs are probably the next least invasive approach. Then lastly, if you aren't going to take care of yourself, you'll have to take one of the drugs, which will probably help some, but all of them have complications.